I would like to welcome Dr. A. Fatima, who will speak about the tunnel for perfection in manual SICS. Dr. Fatima is a medical officer, Arvind Eye Hospital, Tirunelveli.
Stamp the tunnel for a perfect small incision cataract surgery. The manual small incision cataract surgery is a boon to greater number of patients in developing countries, being cost effective and a sutureless technique. The major determinant of outcome in small incision cataract surgery is a sclerocorneal tunnel, as its architecture largely influences the induced astigmatism and proper delivery of the nucleus. The key components of sclerocorneal tunnel are scleral groove, side pockets and corneal entry. Though there are various types of incisions described, the incisions that fall within Cox funnel induce less astigmatism. The Cox funnel is bounded by two imaginary curved lines which are 3 mm apart at the limbus. The frown incision described by Singer in 1991 is the one that falls perfectly inside Cox funnel and also provides large enough room to accommodate nucleus during the Making perfect frown incision is not always easy, especially for novice surgeons, due to limited movement of the wrist joint in ulnar side by nature. So it will be useful to have a guide to make appropriate frown-shaped incision. Similarly, appropriate side pockets are of paramount importance to convert two-dimensional tunnel into a three-dimensional one, providing a wide opening to accommodate nucleus during delivery. The beginner surgeons tend to make either two small side pockets landing in difficult delivery or two big ones which will not take part during delivery of the nucleus. The third key factor, corneal entry, is preferably made 1 to 1.5 mm from the limbus. If the entry is made more anterior, it induces more astigmatism, and if it is made short and posterior, it does not allow side pockets to open and deliver nucleus. For the benefit of novice surgeons, we have brought out a novel device, SICS tracer, which could guide scleral groove, side pocket and corneal incision, thus helping them to make a perfect tunnel. Here, this device is being used on a goat's eye. It has prominent margins which helps to stamp the tunnel shape before starting sclerocorneal tunnel. After aligning the device to the limbus, the stamp is made over the sclerocorneal junction, and the corneal incision falls 1 mm from the limbus along with a margin which guides to make side pocket. The sclerocorneal tunnel is being made following the mark. We would also like to mention the device named Ranjan SICS marker available in the market to guide the external frown incision. This device is advocated for topical SICS surgery, whereas the device we have made will be more beneficial to the postgraduates and novice surgeons who land up in corneal endothelial damage and high astigmatism due to inadequate side pocket and inappropriate corneal entry. Since the corneal diameter of the goat's eye is larger than that of the human, the internal incision stamp in this video does not seem to reach the limbus, which will not be a case in the human eye. In human eye, this device is being used after gas sterilization. This device is a prototype. Further development with appropriate handle will give more ease to make stamping. Recently, with Orolab Madurai, we have come up with a stainless steel stamp for an easier use and effective sterilization. To conclude, this holistic device guides all the aspects of sclerocorneal entry and helps novice surgeon to make perfect tunnel and yield superior visual outcome. Thank you.
Thank you, Fatima. I think
Nice.
that was a very nice presentation. Any questions anybody would want to ask? We can take one question maybe, and then one or two questions, and then go on to this next presentation. What is the cost of this device, if we may ask you?
Madam, it is
it
still
priced?
in,
It
no,
is still
madam,
in.
it is still, we are modifying, making, tuning up. Uh,
Have you
And
patented it, Dr. Fatima?
no, sir, not yet.
I think I'm sure Dr. Suven will tell you that however small or however big it is, always patent it before this is one of my advice to all the young innovators. Never put up anything on a public domain till you are patented it. Don't look at it whether it's small or big innovation. Every innovation looks very small when you start.
Okay, sir.
Yeah,
Thank you.
same advice. I think do it very fast because it's looks quite promising. So I was going to ask same thing only.
Yeah, but my comment over here would be that you have to see the cost. See, the cost of patenting is pretty high. So, and the cost of protecting your patent infringements is also further higher. So, whether you can prevent people from copying it, and whether it's going to realize that value. So you will have small modifications of this, and that will not count as patent infringement, and then the cost spent on it will not be. So you'll have to see how you can protect it. Yes, patenting is always good, and provided it's commercially viable, that has to be done.
Perfect.
Yeah.
okay. Thank you so much, Fatima. Thank you.